Well, good morning, everybody. We're going to go ahead and get started. I'm Ben Wood from the Wausau Police Department. Thank you, everybody, for coming, and thank you to our panelists for being here today. Hopefully, we can move the ball forward a little bit in terms of protecting and helping our community respond to heroin. Thank you for being here, and I'm going to turn over to Melissa, much to her chagrin.
He's like, what? I'm doing the welcome? So that's our short welcome. Thank you, like Ben said, thank you everybody for coming. It's great to have such a great turnout here on a beautiful, beautiful Friday morning. Friday's good already, but a beautiful sunny Friday morning is even better. For today, this is kind of an overview of the agenda. We're just going to go ahead and do a look back. We've been actually doing our pushback initiative for over 18 months. And how many of you have heard of our pushback against drug abuse initiative before? Oh, I love to see hands in the air. Wonderful. Just to kind of highlight some of the successes and some of the things that we've been able to do through that initiative. Also, we're going to be then welcoming up some of our local professionals and people working in the field that we haven't necessarily had an opportunity to hear from in the past with some of our previous pushback efforts and initiatives. So I just wanted to make sure that everybody has a voice, and we've got a lot of our community partners that haven't necessarily had a public forum like this to express that. So we're going to be bringing them up one at a time, and then we're going to bring everybody back together and have a panel in the front and do some question and answers. On each of the tables, kind of spread sporadically, we were recycling paper today because somebody forgot index cards. So if you have any questions as we go through today, and we're asking that people hold their questions till the end just because we want to make sure we get through all of our panelists. But if you have a question, if you want to write on it and just send it to this end, and then Ben will collect them when it gets to that point when we're going to do question and answers. So that's just one thing that I ask as far as how we do that. I anticipate that our program itself will last about an hour, and then we'll have between 20 minutes and half an hour for question and answers. So if you have anything like that, like I said, write it down so you don't forget, and we will make sure that we get to it. With us today, I'm just going to introduce our panelists. We have Deb Hager, who's our Deputy County Administrator. She's going to be speaking first on the impact of heroin on our county and on our county services. We're going to then go to Sandra. I'm going to kill your last name. Ladou-Ives. Sandra Ladou-Ives. I'm looking at it thinking I should have asked how to say this. She's our Marathon County Jail Administrator. She's going to talk about the impact on our jail population as well as our jail census. And then we'll have Dawn Perez, who is with Child Protective Services with Department of Social Services, going to talk about drug-impacted babies as well as those juveniles that maybe are caught in this epidemic. Then we have Dr. Shannon Young from Wausau School District. She's a principal and guidance counselor for the EA Charter School, EA Learning Academy. She's also been in the school district for a number of years, so she's going to be able to talk about the impact on schools. Josh Finke, he's the EMS Division Chief with Wausau Fire Department. He's going to talk about the overdose, how it's impacting their services, as well as the use of Narcan, and some of the things that have come out through recent legislation, how that's impacting our community. And then we have Mark Mosier, who's the Director of Case Management with Ministry St. Clair's. He's going to talk about the impact on our primary health care systems. So, we've got a great panel. It's very diverse. I also want to point out that we've got other folks in the crowd today that if you have a specific question that maybe is not answered here, make sure you still ask that question because there's a very good chance we have another professional, another partner in the crowd that will be able to answer that. So the Pushback Against Drug Abuse Initiative, I just kind of want to break down how it began, what great things that we've done, and the differences that we've made. When we started this initiative, it was back in February of 2012 where we had our first discussions on the impact of prescription medication abuse in our community. We had done an assessment in the fall of 2011 to look at the prevalence of misuse, to look at the perception of risk of medication abuse, to look at the perception of availability, as well as to measure our diversion efforts, which is our medication drop boxes. We have 5 locations. This is a great opportunity to pitch. It's National Drug Take Back Day on Saturday, so please clean out your medicine cabinets, your kitchen counters, your bedstands, anything you're not using, and dispose of those meds. But at that February meeting, we had a panel of people talking about the issue of medication abuse. Every single person on the panel said, medication abuse is a problem, but we need to talk about heroin. Every single person on that panel, from all walks of life, from all sectors of the community. So over the next 5 months, we started collecting data. We started looking at Things like what you see here. Drug overdose deaths, drug overdoses, drug-related crimes, drug-related prosecutions, looking at rates of hepatitis C and HIV. Our community was part of a statewide study because of our high rates of hepatitis C and HIV, directly linked to IV drug use. When you used to see people in their 40s and 50s that were diagnosed with hep C, now we're starting to see people between 18 and 30. That was a hugely alarming statistic, and it's something that kind of crept up on us, directly linked to IV drug use. And finally, the number of persons seeking treatment. Wausau Health Services burned through a year's worth of budget in 4 months in 2012. 4 months, because they had such an increase of people seeking treatment. And again, ages going down. And a great quote from Gary Schneck with the Marathon County Sheriff's Department. He heads up their Special Investigations Unit, or drug unit. We did not know the problem we had with prescription medication abuse until the reformulation of OxyContin, which is, if for those of you that don't know, a very powerful painkiller that was crushed and used just like heroin was. Within a week, heroin flooded our streets, and it hasn't left. And our problems aren't like anybody else's. When you look at where Wausau is located, Wausau Metro, when I say Wausau, I mean the whole area. You know, we're located on the 29 I-39 corridor. We're a hotbed for drug activity. We can't pick up our municipalities and just move them. We can't build walls, though I have got an argument with this very special DA about that. But when you look at the problem in the community, it is something that we knew we had to address, we knew we had to address fast. So we actually had our first meeting in August of 2012 to look specifically at the issue of heroin, to have that discussion. We brought in a great panel of people to talk about it. Again, I think there's a lot of shock with that. Prior to that August meeting on heroin, we had between 40 and 50 people that regularly attended our AOD partnership meetings. At that meeting, we had about 70 to 80. We had another one in June of 2013. After the pushback launch, we pushed over 100 people. So it is an issue that's bringing people kind of out of the woodwork and into our community. So from August until December, we spent a lot of time bringing together a short-term action team, or STAT, as we like to call them. Through the AOD partnership, hopefully you all have heard of that, through the AOD partnership, our local substance abuse coalition, we like to work through small groups to really be focused in our efforts. So for a number of months, we talked about, what is the issue of heroin? What is the issue that we want to try to address? What are our key messages? In December of 2012, I have that as a key date because that's when Gary Friels with the Judd S. Alexander Foundation called me about a day before Christmas and said, Melissa, I've got a question for you. What will you do, or what will $20,000 do for this initiative? And I was like, Merry Christmas to us, right? So we took that money. We worked with Kinsey Green Marketing Group, and Kirk is here somewhere. He's in the back. He is the most wonderful ally that we've had in this effort. They're the creative mind behind our pushback initiative. So we actually worked with them, spent the next 4 months shaping up our messages, creating our great logo, which is recognized again throughout the state because the AOD partnership is recognized as a leader. But it was very clear that the pushback effort could not just be a campaign. We knew that we knew we had to go beyond just raising awareness and educating the public on this problem. We knew we had to move people into action, which is why we call it an initiative, because it's so much more than just, here's all this great information, now do something with it. We are asking people to do something with it. It's built on 3 key messages. Heroin, prescription medication, and other illicit drugs are a threat to our public health and safety. We're not just focusing on heroin with this initiative, because we know that when you focus on one drug, another one pops up. Look at our methamphetamine arrests lately. I'm sure the jail can attest to fill up on that. But we know right now heroin is one of the ones that is having the most lethal impact on our community. The second main message is that funding for prevention, treatment, and enforcement is critical. No one agency can do it alone. No one effort can do it alone. We can't arrest our way out of this problem. We need to make sure that when we have people that are ready to get help, they have the help that they need. And the last one, and I think, as a community coalition person, the last one I think is the most important when you look at our pushback initiative. The fact that we're all impacted by this problem and that we all play part of a solution. We all need to contribute to that solution, because whether you know someone in your home, you know someone in your family, you know someone, in your neighborhood, you heard about someone in church. We're all impacted by this in one way, shape, or form. So we launched our initiative in May of 2013. We had a series of press conferences. They might show up. Series of press conferences. Our first one, we focused on the scope of the problem. Our second one, we focused on ways that people can get involved. Our third one, down here with Lori, was on addiction treatment, and we started talking about recovery. This last one was about how we can build resilient kids and how the community can support recovery. This one here is when we launched our Take Back Youth initiative, which is our way to connect those that are trying to help their loved ones to the resources that they need when they need it. It's an online resource. We're continually updating it. This one down here is part of the reason that we're here today. Wausau Police Department, with the help of the AOD partnership, was one of the 5 recipients in the state that received $25,000 grants from the Department of Justice through the Attorney General's office. They looked to us as a leader in this problem and what we were doing about it. So they invested in us, and that's just a picture from that press conference. Here's some pictures from some of our neighborhood outreach. We've distributed at least 3,000 bags of materials, which you saw the red bags probably out front, going door to door within our community. It includes stuff like how to identify drug activity and how to report it, how to identify if somebody's using and how to intervene, how to get involved with the AOD partnership, and a variety of other resources. So we had some great times. We're planning on going out some more, hopefully this fall before the S word flies, snow flies. But whoops, didn't plan that thought out. But it's actually been really great. We've done a number of, it's kind of that presentation, we'll travel. The driver of this initiative, we've got a lot of, we call it key sector engagement. We've got a lot of people that have helped with this initiative, really help us get it off the ground, help continue to bring attention to it. Because a lot of the times when you have some sort of campaign or some sort of initiative, you have 6 months and then nothing. And we've been able to keep our pushback initiative continually in the news. Our media partners have been great. Our business sector, this is just some examples of some of the businesses that have contributed to our efforts. And again, I cannot thank Kirk and Kinsey Green enough. They've done at least dollar for dollar for everything that we've done through this initiative. And that is amazing. And I have to thank him again. I skipped over one. Here's the media slide. We've had a number of series on different web or different TV, radio, print. When we talk about this issue, I got to give kudos to Pat. People still talk about this cover. This came out of our August 2012 meeting, and when I talk to people about the issue of heroin, they still bring up this cover because it was such a powerful story. Obviously, we've had a lot more people than just those two, but those are two that have been key to continuing to move our pushback initiative forward. So I wanted to make sure that I highlighted those specifically. But a lot of people are part of making this a success. Some of our successes, of course I had to put the coalition successes first, but some of the things that we've seen an increase in our brand recognition. People know who the AOD partnership is. They know what we're about. We've seen an increase in overall awareness. I have a couple slides specific to that, about this issue. We've been able to collect local stories because when you have data, when you have a story to go with the data, there's people that remember both. There's people that only want the hard numbers, and there's people that want the stories. Every great politician knows that. You can put your platform out there, and then you give that story of whomever it is. So I think that is something that we've been able to not only collect those stories, but also to network our parents. We've got a lot of parents that have reached out, and now we're actually creating a little mini network of parents that are struggling with these issues. We've seen an increase in partners that have gotten involved. We've seen an increase in funding. Just an example of some of the funding that we've been able to bring in or has resulted as part of this effort to bring awareness to heroin and other drug abuse. And again, we've had an increase in the state and federal level. People are looking to us as one of the leaders. They are looking to this initiative as a great way to get people involved. The community engagement has been fantastic. Again, a little summary on our pushback outreach, a little summary on our medication drop boxes. And this one here I think is great. Local Crime Stoppers went back and looked at calls prior to our pushback launch and after our pushback launch. And they've seen over a 230% increase in drug-related calls specifically in 1 year. I think that is huge. And that is what we're asking the public to do. We're asking them to partner with law enforcement in this fight. This slide, a little kind of messy, kind of complicated. I stole it from something else. But just to give you an idea, this slide is about community concern. This is from our medication assessment that I had mentioned earlier. We did it in the fall of 2011, and then we did it again in the fall of 2013. You could see that the concern of illegal drug use more than doubled in that span of time. You could see that the concern in prescription drug abuse more than doubled in that time. So I think that that's something that really speaks to the volumes of the initiative. It also, you could see in the life report, I just have some data down there too, that people are paying attention. People are more concerned. Same thing with the perception of risk. You know, if people think that medications, prescription medications, are safer than illicit drugs. People are getting the message. They're paying attention. You can see that jump there. Same thing with if it's okay to take more than prescribed. This is specific to prescription drug abuse, but when you look at the issue of heroin, we can't pull the two apart. When you look at prescription painkillers, it is typically the gateway into heroin, hardcore heroin use. So at this point, I'm going to bring up our first speaker, Deb Hager. And her contact information's here, and we'll actually put this PowerPoint so you can get their contact information onto our website for future use. But I will turn it over to Deb. Did you have anything to project?
No.
Okay. Then I will get out of the way.
Okay, great. First of all, I want to thank you all for coming this morning. This is phenomenal to see such a great turnout to look at an issue that really threatens Marathon County's ability to be the safest, the healthiest, and the most prosperous county in the state. I had a conversation earlier this week with someone who's working on the next edition of the Life Report, in which he said, you know, is this issue really so big? Because it really involves a small amount of people. And my response back was, it is a big deal, because even though it may seem like a small amount of people in comparison to the 135,000 plus individuals we have living in Marathon County, it impacts every single one of us, whether it's our mothers, our fathers, our brothers, our sisters, our children, our nieces, our nephews, or it is impacting our ability to use our public resources in much more constructive and positive ways. And so I'm going to talk a little bit this morning about what the cost is to the community. And it clearly isn't going to cover all the cost to the community, but I'm going to be speaking about where we are investing the public dollars that come to us in county tax levy and what that means. And I'm going to start with looking at the criminal justice system. 6 years ago, when I became deputy county administrator, our primary focus in the criminal justice system was OWI. Now, I'm not here to say that OWI has gone away and we're not concerned about it, but I will say that drug-related crime and addiction has become the primary focus, and I'm going to explain to you why. In 2013, we had 560 persons charged with drug-related crimes in Marathon County. Those 560 persons spent 40,500 days in jail at $50 a day. That was $2 million plus of county tax levy that just went to incarcerate drug-related crime. That doesn't include the district attorney's cost. It doesn't include the court's cost of looking at this. It doesn't include the actual cost of law enforcement prior to incarceration. That is just once the person was arrested and incarcerated. $2 million plus in 2013. Imagine what those $2 million, if we didn't have this issue, could have done for parks, for infrastructure, for access to broadband, for a whole bunch of other things. There's an opportunity cost to this as well as the actual dollar cost. In addition to that, in 2013, we need to look at, because drug addiction doesn't just, drug-related crime and drug addiction doesn't just involve law enforcement. It impacts kids. Children are often in these families that are involved in drug use. And if we look at between 2011 and 2013, we had a 26% increase in the number of petitions filed to protect children. What drove that? In 2011, the number of petitions for neglect without drug involvement were about 41.5% of all petitions. In 2013, those petitions that involved drug and or alcohol use rose to 59.1%. The biggest change was in the areas of neglect with heroin, increased 250%. Neglect with meth and heroin increased 150%. That compared to, it doesn't include all non-substantiated cases. These are actually the cases that were called into social services and were substantiated with neglect or abuse. So that doesn't involve all the others where there may have been concerns, but it didn't rise to a level of meeting actual substantiated neglect. So these are just those cases that rose to the level of what the state law says is neglect of children. That is absolutely pitiful to see that kind of increase, because we all know that childhood trauma is the highest risk factor for kids in terms of their success in school and what's going to happen to them. The other thing that we know is that when you have a parent who is incarcerated, your risk of being incarcerated as an adult increased substantially. So we need to be really concerned about the fact that we see this rise occurring. Then it doesn't just impact kids. A lot of times it also results in death. Between 2012 and 2013, overdoses rose by 217% in Marathon County. These are actual fatalities related to overdoses of drugs. Then we have the mental health commitments, because Marathon County is also responsible for when an individual is not able to make good decisions about themselves and pose a threat to themselves or others, we have to intervene. And what we've seen is a 15% increase in adult commitments from 2012 to 2013. But we've also seen a 114% increase in juvenile commitments from 2012 to 2013. Our youth are at significant risk here. That is scary for the future of Marathon County. Not just the present, but the future of Marathon County. When we look at admissions for drug and alcohol use to North Central Healthcare, we saw 144 alcohol inpatient admissions, only 2 drug inpatient admissions, but we had 11 last year drug ambulatory detox admissions. The average length of stay is 2.3 days, and that is at $582 a day. So we spent about $390,000 on inpatient and ambulatory drug and alcohol detox in 2013. That doesn't include any of the outpatient counseling that occurs after that. That was just to detoxify individuals who were in need of that detoxification. Then, if we want to look at the trends, these are numbers from the district attorney's office. In 2002, which was 12 years ago, the DA's office had 0 cases for heroin-related crime. That has risen in 2013 to 5.9 cases a month. Meth in 2002 was 0.7 cases per month. That average number of cases has risen to 7.8 per month. Now, we can look at it and go, well, okay, so is that just trending overall? Here's the difference. If we look at cocaine in 2002, that was 3 cases per month in the district attorney's office. We are now at, in 2013, 2.9. The most addictive, the most lethal drugs are on the rise. That is scary. These are hard. When people are addicted to the meth and heroin, these are hard cases to treat. They are hard to get people sober and clean and keep sober and clean. This, again, is significant because if you look at the district attorney's office, and I think Kyle will tell you, there hasn't been any increase in the number of prosecutors in that office. This is just the rise in the number of cases that have shown up as a result of what we're seeing in trending. Then the last part is really looking at the out-of-home placements that social services needs to do. We had 55 children who were placed out of home due to drug and alcohol-related issues in 2013. That cost, annual cost, and this only includes the psychological evaluations, the drug testing, the supervised visitation, transportation, and parent aid services, was $437,000 in 2013. We also had 16 juveniles who were placed out of home. Those costs were almost $1 million, $953,000 in 2013 for drug and alcohol-related issues. Now, I need to tell you, this isn't even the total. It doesn't include any of the costs of case management that is provided by social services. This was just direct service delivered to these children and these juveniles. When we look at this, I tallied the number up, and what I can account for is that in 2013, we spent over $5 million in intervening on drug-related activity, whether it's in crime or in treatment or in the cost of taking care of children who are impacted by it. That $5 million is a low estimate because it doesn't include law enforcement. It doesn't include the DA's office costs. It doesn't include the judges. It doesn't include the social worker costs. $5 million of county tax levy that went to address this issue. Imagine what $5 million could do in this community if we could put it to other use. But right now, this is the most important work that we can be doing. So what else is Marathon County looking at doing to try and stem this? The first is we're looking at implementing an adult drug court and possibly a family drug court to address these issues. We've been very successful with the OWI court, and we believe that there is the opportunity to significantly impact people who are addicted and then wind up committing crimes and change lives. But that is very intensive work. We're talking 18 to 24 to 36 months of potentially working with an individual before they're able to go out on their own. It requires residential treatment, it requires courts, it requires case management. It is not a cheap option, but it is an effective option. The other thing is certainly law enforcement is committed to continuing to enforce both the dealing and manufacture and distribution of drugs, as well as to continue to protect the community from the crimes that occur as a result of addiction. I'm here to tell you, we are not going to enforce our way out of this. As long as there is demand, there will be, and money to be made, there will be another drug dealer that will step up. You can put as many of them away as you want, but there will always be another one because the money is good and it's easy. So we need a much broader community strategy. Until we reduce the demand, we will continue to have the problem. And that is, it's the bottom line. We have got to make it unacceptable for people to use and buy and distribute drugs in this community, and until that happens, we will continue to have people willing to come here and take the risk of selling and making money and take the risk of getting caught. So I don't think the other option is, I often hear, well, if you just punish them enough. We're not going to punish our way out of this either. You can't punish an addict into not using any longer. It's going to take tremendous resources in terms of treatment and therapeutic communities in order to make this happen. Right now, we do not have enough public dollars to commit to the kind of treatment that it's going to take to address the addiction in our community. And that's the other reality. So I'm sorry to be the bearer of bad news, but I have to paint a really realistic picture of what this looks like for our community. And I want to thank you this morning for being here and being willing to come in and talk about this issue. Thank you.
Okay, so next up, Sandra. You're up. And Deb is going to have to leave, but I'm going to ask her to leave these stats, so if anybody has questions about some of the data she threw out, I can have it. Oh, Pat first. Sorry, everyone.
Good morning. One of the things that I can do, I think, best today is echo a lot of the things that Deb has shared with you. Unfortunately, on a day-to-day basis, I also see the impact of not only heroin, but methamphetamines, cocaine, and alcohol use. And I realize that alcohol isn't really necessarily placed in the same category as some of these because it is a legal substance to use. The fact of the matter is, in our facility, every person that's in there has either used or abused drugs at one point of their life. We look at the population of the facility and we see that, or you've heard, I'm sure, of the cost of housing inmates out of the jail. Our jail was updated in 1988 is when the project started, or 89. At the time that they opened the doors, it was actually overcrowded. So they've been dealing with a lot of problems since the opening of the doors then. Our current average daily population is 330, and our jail actually has 279 beds in it. That means that we're required to house out between 50 and 70 inmates a day in order to maintain safety and security in the facility. As we look at the buildup or the makeup of the facility, we have 16 receiving cells. That means on any given day when we have 13 to 16 inmates, and about 70% of them come in high or drunk, we have to figure out how we can safely maintain these people and how we can safely mitigate what's happening with them and their bodies as a result of their use. Heroin actually is one of the easier drugs for us to maintain in the jail with our nursing staff because it doesn't create a lot of acting out like somebody who's intoxicated by alcohol or methamphetamine. Our nurses often simply treat some symptoms with ibuprofen, sometimes with fluids depending on the way that they came in and whether or not they've been taking care of themselves. But really, it's not the same type of withdrawal. It's still a miserable withdrawal, but it's not the same type of withdrawal. We have gone from 3.5 nurses this year to we're going to go to 4 full-time nurses next year, just because we have such a need for our population to be seen. It's not just when they initially come through the door, it also has to do with their long-term care. I have one gal who I've spoken with who had 23 feet of track marks on her arm. Now, when you're talking about the number of needle uses per inch on track marks, which is 50 to 100 injections per inch of track mark, consider the amount of usage she's had. One of the things that a lot of people talk about are Narcan. Well, I think that it's a fantastic use for people like paramedics and doctors and things like that. One of the concerns that we have in the facility is that a lot of these users who are on the street that have access to it think that it's a foolproof safety net. I have one gal who said, I got as high as I could because I knew if I had the Narcan on me and I hoped that it would save me. And I did it 3 times in one night. That's not something that Narcan's going to fix forever, and that's how people die. And so that's one of our concerns. Nursing staff, when I talk with them, they worry about that safety that probably really isn't there. When we look at the jail staff, they're having to increase watches on a lot of these people that are coming in, which is very labor intensive. And as you probably also have heard, we are stretched to the limits. So it is an increase on our ability to really maintain the care and custody of these people while we're trying to manage a population that is already growing out of control. A couple of the things that we've been able to do is when somebody comes in, we ask them, will you submit to a urine test when we think that they're on something and we're not sure what it is, and they might not really be comfortable telling us because they think that we're the cops and we're going to do something about enforcing or charging them. And a lot of them, when they feel safe, they'll either tell us what they're on or they'll do the urine tests with our nurses so that we can establish, yes, they've used, or it's still in their body, whether it's methamphetamine, heroin, some other type of benzodiazepine that even if it's prescribed. So that's one of the steps that we've been able to take, but again, costs come with that. We've increased our budget for urinalysis from just under $1,000 to what we believe is going to be close to $5,000 next year. Let's see. The other concerns that we really have in the facility is officer safety. As she had talked about earlier, the increase in bloodborne diseases. The first question every officer will ask you when you walk through the door of the facility is, do you have anything on you that will pick or poke me? Is that a sad day? We have to worry about needles, we have to worry about broken glass pipes, and it's all just because we want to take what's in their pockets out of them. And you would not believe the number of people who do not tell you. So as far as the facility goes, it's also another gloom and doom situation, and I hate getting up and talking about these things because when we talk about the jail, we always want to talk about the good things that we're doing for people. We do have a couple of programs that are very well received by a lot of our inmates. One is a corrective thinking program called Breaking Barriers. When inmates are in the facility, they have the opportunity to take part in that, and it's been very successful, especially for those who've been able to complete all 17 weeks. But as far as alcohol and other drug-related programs, there's just never going to be enough. And so again, kind of echoing back to what Deb said, it needs to be something that's available to the public while they are out on the street, and they are the public and they're not incarcerated. I think the final thing that I kind of wanted to say is that the population in the facility is also very high based on probationers. A lot of times these probationers are out on the streets and they use, and that's the sanction that they receive is that they come back to the jail 30, 45, 60, 90 days because they've used some type of illicit substance, and the probation agent is attempting to establish some sort of treatment, but there just isn't the level of treatment in this community to meet the need. And so I guess if there's one thing that I hope for from the jail perspective in reducing our population, it is for the community to be able to come together and establish those programs so that they don't end up in our facility looking for some type of programming there. All right, thanks.
Dawn. I don't know whose copy this is.
Well, I just want to thank you all for just giving me this opportunity to share a little bit, just a piece of our world at Child Protective Services. And that also includes juvenile justice services. We have economic support as well, child support at social services. So really thank you for giving me this opportunity. And I want to start by sharing a story with you. And this story would be much like any one of the cases that we might see or work with at Marathon County. So if I can just ask you to just mentally picture, image right now, in your mind right now, picture a person going through withdrawals. And what that might look like is that person would probably be sitting in a very dark room because light is really hard to tolerate when you're going through withdrawals. For all sakes and purposes, we'll make this a female. So she would probably be drenched in her own sweat from going through those withdrawals, maybe even drenched in her own feces. She would probably have lost weight because of this struggle that she's going through, this withdrawal. She may be crying uncontrollably, and she may be shaking and unable to stop that shaking. So she would be physically exhausted because of what she's going through right now. And what I want you to picture is I want you to picture that she's 1 day old. So this is a newborn infant that has spent the first 24 hours of her life in pain, sweating, shaking, and crying inconsolably. This is really, really hard to watch, and this is something that we see all too often in our job right now. So you probably want to ask yourself, why did her mom use when she was pregnant? Why couldn't she put the needs of her unborn child over her own needs? Why couldn't she go and get help? And the answer might surprise you, because right now in this area, we don't have services for that type of help. So we have to contract with agencies in Milwaukee to provide that type of service to that mother. And for our uninsured and our underinsured, that comes out of tax levy. There's not even the opportunity to pay for those services. So I want you to keep that in your mind when you're asking yourself, why didn't she do something? Because most often what we hear when we are intervening is, where do I go? Where could I have gone and gotten help? Drugs like heroin incapacitate parents and require us to intervene on behalf of the safety of those children. When parents refuse or are unable to provide for their children, we must intervene and assure for that safety. And like Deb had stated earlier, all too often what we're required to do is remove those children from that home. Drugs like heroin are tearing families apart in Marathon County. It is the #1 reason why we have removed children from their natural home. 55% of our children who are in out-of-home placement are due to parental alcohol or drug issues. 55%. And then we ask those parents to stay clean so that they can establish safe and stable housing to return those children home. And we have a lack of services, treatments and services to send those parents to address those issues. So our number one issue is our number one need for treatment and services in our community. So as Deb had stated before, what is the cost of these out-of-home care children, these children that are placed in out-of-home care? So the approximate cost without social work, etc., involved in that for those parental AODA issues is $438,000 per year for keeping those children in out-of-home placement and keeping them safe. And removing children, it's an unsustainable response to the AODA treatment, to the AODA concerns of their parents. It's an unsustainable response to that, because we can keep the children in out-of-home care and the cost will continue to rise and we will still have the AODA concerns of the parent if left unaddressed. So why do I say treatment and services are the answer to this problem? Remember that little girl going through withdrawals at 1 day old? Now try to picture that girl 15 years later. So now at 15 years old, her parents didn't receive treatment and services. So what has she lived and learned her entire life? Addiction. So statistically speaking, what will happen? She's a few years away from adulthood, maybe has already started her family or looking at starting a family in the near future, and what will happen? So at 15, she begins to experiment with drugs, and now she comes to the attention of social services as a juvenile delinquent. And the cost as a juvenile delinquent, those double. Like Deb had said, dealing with her treatment and her addiction, we go from the $438,000 per year cost to $954,000 a year cost. So now the cost is doubled in treating those juveniles with the AODA issues. And so now what'll happen when this young lady starts planning her family? We're right back to the beginning, right back to where we started. We have a new young lady who's struggling with addiction issues, and we're called to the hospital to observe her child at 1 day old going through withdrawal. So what do we do to stop this cycle? My first request on behalf of children and families is we need to carefully review the Children's Code. It's Chapter 48. It's what determines what we can and cannot do in Child Protective Services. We need to review that Children's Code and look for areas where we can strengthen our ability to protect drug-endangered children. And before we roll out another mandate of service that social services must do, we need funding associated with those mandates. The funding must meet the needs of the mandate for drug-endangered children. We also need to increase the services that we can offer to expecting mothers who are using and seeking that help, as well as those parents who want the help so that they can get their children back into their home and maintain them safely. So I call you to help me raise awareness about drug-endangered children, the cycle of effect that is impacting families in Marathon County, and to advocate for change to protect those drug-endangered children and to provide services for those families.
Dr. Shamanya?
to the principal's office.
Good morning. Again, you've heard it already several times this morning, but thank you so much for packing the room this morning, because I think it definitely continues to send the message that this issue is very important and that we are understanding how much it is impacting our community. On the school perspective, I spoke with Dr. Jeff Lindell, who's the Director of Pupil Services in the district, and the school-based messages that we want to make sure that you understand today is that you've already heard the statistics. So you know that more and more of our students and families are impacted by this. And I think the big piece to think about on the school end is that we have these children who are coming into our classrooms every day. So when you look throughout the district, you look throughout our county. So you heard the numbers in Marathon County. Those kids are going someplace every day. They're coming to school, we hope. Because when they come into our schools, then we can care for them at a certain level. One of the things that stuck out in my mind was when you have the reports to social services, many are substantiated, many are not. Just because a report isn't substantiated doesn't mean that we don't have a child who is living in a situation that is not ideal. So we get these kids into school, and you know the school responsibility, and you hear there's plenty in the news about what we're supposed to be doing and how we're supposed to be educating them and how we're supposed to be teaching them. And I think when I look at that as a whole, please remember that our teachers and our staff members, first and foremost, absolutely we want them to get a quality education, but we care about them as individuals. We care about what's happening to these kids. So when I think about things that are currently happening to address it, our school systems throughout the area, we run fabulous health classes. We bring experts in from the community to address our kids on these issues. We always run the balance between making sure we're not giving them information that's going to make them want to seek out any of these. It's a challenging balance, especially when you're working with teenagers. I believe most of the schools in the area continue to bring in Sue Nowak to help with some of their drug education, and I think that it's a very well-known name. In addition to those health classes and trying to pay attention to what's going on with the kids, one of the biggest things that our schools throughout this entire county do, so I can speak on behalf of the Wausau School District, but also being connected with other districts. I see Mosinee here, and I know DC Everest, and is we build relationships with kids. We build relationships with kids every day so that if there is something going on with them, hopefully we find out about it. So when you're thinking about resources and things that schools need, we hear the unfunded mandate piece comes up, absolutely. But there needs to be a piece of community support and recognition about the fact that your school staff very definitely are on the front line. From our bus drivers through every single staff person in our building, we build a web of very caring individuals who look out for our kids. And we have to do that because you just heard, we've heard the statistics, the numbers on what's happening here, and the number of our kids that are either coming from those homes where there's a parent who is dealing with their own addiction and they are not able at that point in time to care for their child. It's not that they don't want to, and I think that that's one of the things I know I've said to students for years and years. No one wakes up one day and says, oh, I think I know what I'm going to be. I'm going to be an addict. It doesn't happen that way. It's this slippery slope that we've described, and the prescription painkillers are definitely a gateway into some of these other substances, and they are impacting us. What we're seeing in the schools is kids with a lot more needs. When you have to be removed from your home, as was just described, all of those kids that are removed from their home, even while their parent may be struggling with something very difficult, and that's not an ideal situation, they still want to be home. That's a tremendous loss. And then we expect them to come into school because our job is to educate, and we want to make sure that they have their homework done and their pencil and their planner and their, it's a very challenging balance, I would say, on the school end. Our schools do a great job of trying to look out for these kids in so many more ways than I think is visible on a daily basis, because a lot of those interactions happen very quietly, one-on-one, in the school settings. There's one custodian that comes to mind. I have a custodian who, as she's cleaning the floors on the outer edge while the students are eating, she will come and tell me if somebody didn't eat. Did you notice that so-and-so didn't eat today? Does he have money in his account? Does he need? That's the kind of caring individual that we have in our school systems. So we can be a safety net, but we can't do it alone. I would say one of the things that you can do to help support schools is find out if your school district is looking for mentors. Find out if your district wants people to come in and be a positive individual in that school, whether it's reading with some of the younger kids. I can speak now on behalf of EEA. We are looking for mentors to come in and connect with our kids on a regular basis, be one more strong person in their lives, because that's what we're going to need to help overcome this. They have a lot of challenges in front of them. Early identification is critical. While we try to build those relationships, some of our children hide things very well. If you have information or concerns about a child, don't hesitate to call somebody. Whether if you don't want to call social services because you're concerned about your neighbor kid, call the school. We can't tell you anything about them, but you can tell us if you have a concern, and then we can do a little checking around. We won't be able to report any information back to you because we need to keep that confidential. But if you're concerned about a kid, get a hold of somebody, and the neighborhood school is a great first place to start, especially if you're not comfortable making that call to CPS first. We'll give them a call and say, this is what we have going on. We do a lot of training of staff. We try to make sure that the adults who are working with our children are aware of what we need to be looking for and what we need to be paying attention to. But things change very fast, and it is challenging at times to stay ahead of the curve. That secondary, I just can't say enough really about the secondary impact of parental use and what impact it has. Do we see kids in the district who are using themselves? Absolutely. And there's a lot of efforts made to work with the different agencies that, once again, you already heard the data, that they are overtaxed as well. But we are fortunate to live in a county that has amazing partnerships. And the way that the folks in this county come together and come around the table to try to figure out how to meet needs really is, it's phenomenal. And this doesn't happen this way everywhere. So we have a huge problem that we have to address. But I think it's evidenced by the number of you here this morning that I think we have the resources that we need to do it. More financial resources, of course, also helps. The treatment, again, I know this is school perspective, but from what we see in the school, if there were more access to treatment in our community, it would be a lot easier for our families to start making the strides forward that they need to and to overcome the issues that they're facing. So I know we're short on time. Thank you.
Did I pick up the right one?
That's it. Yep.
Perfect. I'll give you the clicker.
All right, good morning. My name is Josh Finke from Wausau Fire Department. Bottom one.
Yep.
Just going to talk from an EMS perspective about heroin. We don't get as touched by it, I guess you could say, as a lot of the people that have spoken already. We certainly have had an increase in use of drugs like Narcan, which you've all had heard about this morning already. So we're going to talk about that a little bit. But the effects of Narcan on the body, it really depends on the dose the person has taken, and in a lot of cases how pure the drug actually was. So altered level of consciousness, sometimes these people are just very confused, very drowsy, again, depending on how much they took. Sometimes they can have decreased blood pressures, but really the biggest issue that it brings is a decreased respiratory effort. So heroin really suppresses the patient's ability to breathe, and in many cases can completely stop their respiratory efforts, which is obviously constitutes a pretty significant medical emergency. We've had several of those over the past couple of years. We'll talk about our numbers here in just a second. But we've had several patients where when our paramedics get to them, the patient is blue because their respiratory effort is either very suppressed or they become completely apneic where they're not breathing at all anymore. So our increase in use of Narcan, we started looking back in 2010 where we're averaging 1 per month. And when you go to 2014, if our current trend continues of the number that we've used so far, it's going to average 3.25 per month through this year. So our numbers have, as you can see, tripled over the past 4 years. So it's certainly a significant issue. And I should mention that Narcan, this is just our use of Narcan. It doesn't necessarily mean it was a heroin overdose. We use Narcan for other reasons also, but the important thing there is that we also don't use Narcan on every single drug overdose call. It really depends on the severity. So a lot of these patients, when we get to them, they're to the point of where in some cases they are dead, and we have had fatalities from drug and heroin overdoses. But a lot of times they're really on the verge of going into cardiac arrest. So a lot of these patients have had severe respiratory distress leading to hypoxia. Their body doesn't have enough oxygen to support its needs. And again, like I said, we've had some deaths related to these narcotic overdoses. So Narcan works by blocking the receptors in the body. Your body has receptors that allows the heroin to work, and then we give the Narcan, and it's a competitive drug that'll basically push that narcotic off of that receptor. The Narcan takes over and blocks any more of the drug from becoming attached to that. It works very quickly. You get a very quick reaction to this, and in some cases, as the jail administrator is probably very aware of, these patients aren't necessarily happy when we take away their high. They've paid a significant amount of money for this drug. They want to enjoy their high from it, and we've had issues where the patients can become combative. Side effects of Narcan are generally minimal, works, like I said, very rapidly, can now be carried by all levels of EMS, including law enforcement. So some law enforcement agencies, I'm not aware of any in the state, I'm sure there are some, but law enforcement now can carry because of recent legislation that was passed. Prior to 2014, this drug was only carried by advanced level EMS providers. An issue I see with this is that it really puts an extra burden on some of the providers, like the EMT basic services, which Wisconsin has a lot of. These services are generally volunteers, people that don't get paid either anything for their efforts, and if they do, it's very, very minimal. So we're asking those people now to remember how to use an extra drug, remember dosing, and things like that. So those are really the people I see this putting an extra burden on. This is a drug that we've carried for years. But asking the people in the rural area that are already very underfunded and really understaffed because of the drop in volunteerism to do an extra skill, I think is becoming an issue. A little extra demand on the system. Our call volume generally goes up about 2 to 3% every year. So any increase in call volume obviously puts an extra strain on our system. So that additional use of heroin only makes that a little bit worse. And sometimes these can be what I would call a labor-intensive call. If we get a dispatch information for a patient that's not breathing, we send an ambulance along with an engine company. So that takes basically one of our whole stations out of service to protect their coverage area while we're dealing with one of these patients. We talked about the issues in the rural area, again, mostly covered by volunteer EMS. We're now asking them to do an extra skill that a lot of these volunteers, quite honestly, just don't want to do because of the extra time demand it incurs on them. So the big picture, like we talked a little bit about not just heroin today, but heroin is the main focus of this, but it certainly isn't the only problem in our community. We get a large number of calls related to drugs and alcohol in a whole. I did some searching through our database. In 2014, so far we've had 312 calls related to alcohol. That's a significant amount we're averaging 26 per month, or a little bit over that actually. So it doesn't just create an issue for us. We're going to talk about the effects on the emergency department here, I think, in a little bit, but a lot of times it's an overloaded system when we take these patients to the hospital. And again, they're not the kind of patients you can put into the emergency department room and just kind of leave on their own. A lot of times they're combative and not real happy to be there. So it really causes a strain on our system. So I know I went through that kind of quick. Again, we're on a little bit of a time crunch, I think, here, so we'll talk about questions a little bit later. Thank you.
Okay, Mark.
Hey, good morning. I'd also like to thank you for being here and your interest. And because we're running late, I'll try to be brief. I may not succeed, but I will try. Okay. I can only talk to you about the experience at St. Clair's Hospital, where I'm employed, and my role as a social worker there. And frankly, we do not see a lot of people that are admitted strictly for a heroin overdose. It could be because of the use and availability of Narcan. It could be because of our geographic location. We're not as close to the population center of Wausau as Aspirus is, and of course in an emergency you go to the closest place. We certainly see some that are brought in or dropped off and left in our emergency department parking lot, but not a tremendous amount. What we do see, however, and what we're seeing more of, is the negative health consequences of heroin use, such as endocarditis and cellulitis and abscesses and various infections and bone osteomyelitis and those conditions. Now, it's hard to get your hands around, at least in the hospital setting, specific numbers of people that are admitted because of their heroin use, simply because the way the system is set up, they're coded based upon their primary diagnosis and what they're admitted for, like the bone osteomyelitis or the infection or whatever. But still, in the hospital setting, these cases are incredibly challenging for us for a number of reasons. First of all, the urge is often so strong that a high percentage of these patients just sign out against medical advice as soon as they can. Often they are not ready to go, they are unsafe to go, but if they can physically walk, all they have to do is sign the paper, and many times they do walk. Also, many of these folks lack positive supports. So their follow-up with their primary care physician, their continuation on the medical regimen they should be following is not good. So what happens? They come back in. We've had a number of cases where a patient comes in a crisis, feels a little better, signs out against medical advice, doesn't follow up, comes back in, signs out against medical advice, goes home, doesn't follow up, comes back in, signs out against medical advice. Tremendous revolving door syndrome. What do? You got to take care of the patient. You can't refuse them. Needless to say, a lot of these folks also have little or no insurance. And many times the things they come in with are the higher cost issues, harder to treat, have longer lengths of stay. We had a patient not too long ago that came in and needed 6 weeks of costly IV antibiotic treatment a couple times a day. So we put an access line in for the IV antibiotics. We did not trust him to go home and not use that line to shoot up with. And he did not trust himself. So what did we do? Well, we kept him in the hospital for 6 weeks on this complex, high-cost antibiotic. No insurance, minimal job, no assets. What do? Can you imagine that bill? You write it off. Okay? And a lot of times if they are eligible for various programs through our screening, the patient still has to follow up and complete the application, provide the supporting documentation and so forth. And many times the compliance with that process really is dismal. And unfortunately, a lot of these folks, because of their heroin use and these underlying medical conditions, oftentimes have lifelong disabilities that really impair their stamina, their endurance, their ability to get and maintain a job, and certainly it negatively affects them from an economic standpoint on a lifelong basis, and certainly society as a result. But certainly one of the most difficult things we faced and we see is when drug-addicted moms come in to deliver. Oftentimes these moms have not had the prenatal care that they should have, either because they don't want to be discovered or maybe with everything else going on in their life, it's just not a priority. And the results many times are lower birth weights, slightly higher prematurity rates, but certainly our biggest concern is the addicted babies, and Dawn certainly spoke to that also. If we suspect a baby may be drug addicted, we will check them every 4 hours, and usually the signs or symptoms show up within 24 hours. And watching a newborn go through withdrawal is just gut-wrenching. They are miserable, they have a shrill cry, they cry constantly, they're tremulous, they're irritable, they shake, they have explosive stools, they need morphine to manage their symptoms, and it's really something that you don't forget. And this may take a couple days to a week to go through the withdrawal process. And then certainly there's the ultimate impact, like a couple of weeks ago when we had to have the discussion with the parents who made the decision to take the ventilator off their 20-some-year-old daughter and just let her die because her condition was unrecoverable from her overdose. Okay, well, so why should we care about all this stuff? And frankly, a lot of the people I talk to, and as you know, they don't care. That's them, this is us, it's not in my neighborhood. That's kind of the seamy underbelly of society. Don't want to talk about it, don't want to be concerned about it. Well, as I think you all know, and it's been stated multiple times, we all pay the price for that. In our standpoint, it results from higher charges for your ED visit, higher charges for your hospital stays. The costs are spread out over the general population and shifted to you. It's shifted to those that have insurance. You have to do it because that's the only way to stay in business. And then what happens? Of course, your insurance rates go up. What happens when your insurance rates go up? You have less expendable income. You have less ability to buy the nicety, the little extra things in life. Doesn't help grow the economy. If you're a business owner, your premiums rise. There's less hiring, less expansion, less opportunity to be profitable. It affects everyone, not to mention more crime, more impaired drivers, and certainly the emotional devastation that comes with some of these overdoses and deaths. So, what do we need? From my rather skewed myopic perspective, in the hospital, there's three things that we really need, I think. One is we need inpatient treatment options. Not just inpatient for detox and 48 hours you're out, but inpatient treatment options. There are none in this area, none. Now, there are programs and places that you can go for inpatient treatment as long as you have a good check for at least $8,000 up front or a valid credit card. Yeah, then you have options, but that effectively eliminates 99% of the people that we deal with. The resources just aren't there. We have outpatient services, okay, a couple hours a week. You know, what do you do with the other 23 hours a day? You're back in the same environment with the same friends, the same stressors, the same influences, and usually the same result. Now, I know that there's some research out there that says that outpatient treatment is as effective as inpatient treatment. I don't buy that. The people that I see, you really have to physically remove them from their environment for a period of time to help address the issue and help them get their heads screwed on straight. Okay. The other thing I think we really need is we need more support for psychiatry training and psychiatry residency programs. There's a critical shortage of psychiatrists in this area and nationwide. Now, I know this is about drugs and not mental health, but most of the folks we see are dual diagnosis. Yeah, they're drug addicts, but they also have severe depression, anxiety, bipolar disorder, schizophrenia, and oftentimes they are not treated or not treated adequately. And it's kind of a chicken and egg sort of syndrome, but I'm convinced of the patients that I see, unless you address some of these underlying mental health issues, you will not have good success addressing their addiction issues. And then the last thing, which is only my opinion, you may not agree with, but I really feel that we need an easier way and a quicker way to involuntarily detain these patients for evaluation and consideration of treatment. We do have the 3-party petition process, but it's not easy, it's not quick, it's difficult, it's cumbersome. And parents frequently come to us and just plead for our help. What can you do to help me? What can I do? My child's life is going to hell. It's a downward spiral and they don't seem to care. What can I do? And outside of the difficult 3-party petition process, there's not much that indeed they can do. Personally, and I know it would require a legislative change, is something similar to the Chapter 51 for suicidal patients, where they could be easily detained for at least a mandated assessment and short-term intervention. Now, I also know the research that says that, yeah, and common sense says, people aren't going to change unless they're ready to change, and by and large, that's true. But getting some people into the system to be confronted with this for an assessment and a frank discussion of treatment options is going to help some folks. And we'd be helping more than we're helping now. So, anyway, that's just my snapshot of what I'm seeing and the needs from a social workers at St. Clair's Hospital. So is it a problem? You bet. Is it a growing problem? Certainly. And again, something we all need to take seriously and find better ways to address, not only because of the impact on the individual's health and the long-term impact on their health, but certainly we all have skin in the game. We all pay the price one way or the other. Okay, I'm done. Thank you.
Okay, while we get the panel set up for any Q&A, I'm just going to have Ben wrap it up.
All right, so I'm going to try and wrap this all up in a pretty little bow for everybody. I have a couple of thank yous. Everybody's, I think, said thank you for everybody for being here, but it is one of the most important things is everybody in this room caring about our community, trying to make a difference in our community. The Judd S. Alexander Foundation, I'd like to thank them for their initial investment in creating the Pushback Against Drug Abuse Initiative. Of course, Kinsey Green, Marketing Group for their creativity behind the Pushback campaign. Aspires for this facility, the Public Access for recording and sharing this summit. The panel, of course, for your insight into each aspect of this problem. And the Department of Justice for that $25,000 grant for our community to try and make an impact on the problem. There is a survey that everybody has here that Kirk from Kinsey Green passed out. It would be great if everybody would take the opportunity and the time to jot a couple of notes on there. And just to wrap this up a little bit, just prior to the Q&A, I typed up this whole spiel here and what I was going to say. A lot of what I was going to talk about is this SCAOTA, this Wisconsin State Council on Alcohol and Drug Abuse. It talks about 5 pillars that we can work towards within our community. There's a lot of great information, stuff that everybody in this room can take, read, and things that you can do right now today to make an impact in your community. So it's online. Melissa has the link. Please take the time to review it. And I'm not going to talk about all of that. I just want to let everybody know that about an experience I had on the way here today. At the risk of getting a little sappy, there's a lot of negativity towards this, but I kind of had a spiritual moment on the way here. It's been a long, arduous, emotional week. Probably not much different than a lot of people in this room have experienced recently. But the sun was coming up, it was over the trees, I was on the interstate driving here, and the colors are beautiful, and it just dawned on me that we really are lucky to live in this community. It's a beautiful place to be, the people here are fantastic, and I feel very fortunate to be a part of this community. And then a song came on from Sugarland, and I love Sugarland and Jennifer Nettles. And it just kind of added to that moment, and the song was Stand Up. And it's about standing up for the silent and the brokenhearted. Those are part of the lyrics. More of the lyrics are, change is coming, can you feel it? I'm trying not to break into song right now, because you probably bringing us into a new tomorrow. Won't you stand up and use your voice? Change is coming. I can feel it. It's because of everybody in this room today. That's why change is coming. Because we can all make a difference and we all care about our community. We want to make that difference. I'm a community member. I'm a police officer. I'm a parent. I'm a husband. And what really drives me are my children, and I think that's not any different than anybody else in this room. Our children, like a lot of these folks that talked about today, that's what drives people. That's what we really care about. We want to make it a better place for our children to grow up, for them to be adults, so they want to stay here and be close to us, right? So, I'm not sure exactly where I'm going with this because I don't have my prepared notes, but we've heard a lot of bad news, and I just wanted to try and bring some positivity to this day, to this summit. Our speakers here are tremendous. They've got a lot of information and knowledge, and I know that moving forward that everybody in this room can help make a positive difference in our community. I thank you very much for being here and for helping me raise my children in a wonderful place, and let's move forward. Stand up and use your voice. Let's do questions and answers. I don't see any questions on the sides here.
I got some.
Oh, Melissa's got it, okay.
I was trying to figure, are you guys getting blinded by the thing? Oh, well, I'm sitting over here hitting everything, I'm trying to figure out how to shut it off, but since I don't have to. Josh, how is Narcan administered?
It can be done 3 different ways, actually. It can be given just as a shot intramuscularly. Most of the time we'll give it intravenously. We typically start an IV and give it. Some of these patients, like we talked about earlier, since because of their drug use, their veins can be sometimes difficult to start IVs on. So we can also give it intranasally. Basically, we hook a little device up to the end of the syringe and it squirts it into their nose and it atomizes it to some very fine particles. There's a lot of mucous membranes in your nose and it can be absorbed very quickly and very effectively. So 3 different ways.
Okay. Sandra, you mentioned that you have to house inmates out, or house out inmates. What does that mean? Where do people get sent?
So our inmates are housed out into 3 other county agencies. We're currently housing in Lincoln County, Oneida County, and Shawano County. And what we do is we pick people who generally do not have a court date coming up or who are sentenced but not exercising any type of labor privilege, and we ship them to those other counties. It's a cost of between $40 and $50 a day depending on where we're shipping them to. So you multiply that times 70 people a day times 30 days a month. We look at anywhere between $60,000 and $80,000 a month in paying out housing.
Okay. Mark, maybe you will be the one for this one. Help me understand the third-party process, third-party petition process. How does that work?
Okay, basically it's something that needs to be started through Corporation Counsel's office, where if there are 3 individuals, including those that have direct knowledge of the individual's behavior and its deleterious effects on their health or social functioning, can basically complete a form and file it with Corporation Counsel. They are also now, and talking with Scott Corbett and working with him, he and the judge are also requiring a medical statement from a physician that basically says that if this is left unchecked, it will have permanent negative health damages or result in death. Now, the difficult thing also is because of the requirements for that and the medical or physician statement, a physician may say, you know, I've known this guy 12 hours. I really don't know his history and I can't adjust to that. They many times do not have a primary care physician or one that they've seen recently, and they may say, you know, I haven't seen this guy for the last month or last year. I don't know what's going on in his life. And sometimes back and forth it goes. And again, that slows down the process. And these petitions have to go through Corporation Counsel's office. They have to present it to the judge. The judge has to say that there is validity, that this individual is at risk, and then he can issue an order. And if the order goes through and they're medically stable, they can be taken to the healthcare center. So there's quite a process to go through, and many times it can fall apart at any step. And oftentimes, because of the complexity and the difficulty, these poor parents who are beside themselves just get frustrated and just the process falls apart.
Okay, Shannon, I think I'm going to have you address this question because it pertains. Deb Hager mentioned we can't enforce our way out of the issue. Any thought of community support for community activities as an alternative activity for kids?
Absolutely. You know, I think we look at the lives of our kids, and I think one of the key challenges to that, because I've thought about this and seeing some of the different things that we've put together, And I'll use our local skate parks as one of them. I think we create activities for kids, but as time goes on, one of the things that I think ends up missing is some of that positive adult interaction within the context of that activity. So, we can plan all kinds of great things. A, we have to have the kids involved in the planning because they know what they're going to be willing to do. But then B, we can't, as the adults, absolve ourselves of the connection with them once the activity's in place. I really feel like there are a lot of kids who are continuing to just crave some positive interaction, and it's not, when we think back, I had a conversation with someone in the last week. When we look at one of the single best strategies to prevent drug abuse in our kids, it's not rocket science, it's eating family dinners together. That is one of the top strategies. So sometimes I think we get segued a little bit by thinking we need to plan all these other great things. We need to spend time with kids, doing some of the things that they might want to be doing. Maybe it's a walk, maybe it's going out with them and taking pictures of all these beautiful fall leaves, finding out some of the things that they're interested in. I think the challenge that we face as adults is that takes our time. So, but then that becomes a self-reflection process for us as the adults in the community. Where are we willing to devote our time and what's important to us? And Melissa, if I could, a personal story on the commitment process. 3 years ago, when I was the chair at the time of the Marathon County AOD Partnership Council, a close family friends of ours, this was actually a family who had built our house, and this individual had worked on the building of my home. And I'm good friends with his aunt. My daughter was looking for her one night at the fair. It was the fair, and I called her and said, Allie's looking for you to go to the concert. And she said, we're not there, we're at Todd and Debbie's house. Justin died today. This was a family that they had contacted me, knowing the connections, knowing I was part of the AOD Partnership Council. He died from a heroin overdose. They tried all kinds of things. They tried all that, but he was over the age. They couldn't he was legally an adult. He could make his decisions. So despite all of their efforts to try to protect him from himself, it didn't work. And I think I would agree, there has to be, we can't force people into treatment, but at the same time, we're not necessarily protecting people as much as we could be.
Okay, we are at 10. I understand if people have to go. One thing before I entertain any more questions is to make sure you all got it says survey, I think, at the top. Pushback survey, it's black and white copy, full page. Please make sure you fill that out. Please make sure that you leave it then. You can either leave it in your spot or leave it on the registration table. That's going to help us plan our next, what we're going to be doing with our pushback initiative as we go forward. With that, echoing again thank yous, are there any other questions for the panel? Yes, ma'am.
Where can we send this survey if we don't have time to fill it right now?
You
Where
can
we email it to? We'll
sure.
Scan it, email it to
Email it to me.
And that is?
Melissa, MELISSA, .Goddard, at co.marathon.wi.us. I know.
Do it one more time, Melissa. Yeah.
Eileen's on it. Or you can send it, I should have given this one, or you can send it to aodpartnershipcouncil@gmail.com. I probably do, yes. And you can find us on the aodpartnership.org website. Any other questions? Kyle?
Do you think, I guess, Dr. Young, with the at-risk youth in the community and in the schools, we talk about parent involvement and adult involvement with the community, do you think the kids are receptive to that generally, or has the cycle of the addiction and lifestyle that they've grown up in kind of already taken over and they're not willing to engage or not wanting to engage?
The first part of my answer to that is, one of my biases personally is that we have to, when we talk about who's at risk, every single one of our teenagers, every single one of our youth is at risk. They are at risk of making one choice, one decision that could forever change the course of their lives. So I think from our students that we think are just, they're doing great, they're pulling straight A's, they're on this team and that team, they're just as much at risk because, stressors. We have so many, our teenagers have so many stressors pushing in on them. So, so that's the whole, I think we have to view kids, we can't feel like we can, identify necessarily a certain subsection that we have to pay more attention to. We can identify some risk factors, if we know that the parents are that the child is placed out of the home, obviously, we need to provide some more support for some of our kids. But I think absolutely the kids are receptive. I get the blessing of working with teenagers in grades 6 through 12 every day. They want attention. They want positive attention. They want people to care about them. And they want to know that we do. I have teenagers who, at the end of the day, will, they have to make sure that they check in with certain adults before they leave for the end of the day, just to say bye. They make sure they greet you in the morning. So I think they really do want that contact. Just unfortunately, some of them have not had it, and not necessarily because of ill will of anyone in their lives. But if we have parents who are working 2 or 3 jobs, if any of those jobs are second shift, which you can't work 2 or 3 without one of them being, we have very busy family lives, and I think it takes away from some of that time that we devote to spending some of the time with our kids.
Here's a shameless plug. Go to therealhappyhour.org
Yes.
for ideas of how you can spend time with your family. Yes, please. Shameless plug. Okay, so any other questions? Okay, let's give a big round of applause to our panelists.